Good morning. The first item of business this morning is consideration of business motion 17582 in the name of Graham Day on behalf of the Parliamentary Bureau setting out a business programme. And could I call on Maurice Golden to move this motion?
Moved.
Thank you very much. And no member wishes to speak on the motion. The question therefore is that motion 17582 be agreed. Are we agreed? Thank you. Yes, thank you. Mr Lyle. And just for information, that's just to make sure members know that the business this afternoon starts at 2 o'clock, not at 2:30, so that's what the change is for. Business at 2 o'clock. So we're going to turn now to general questions, and our first question is from James Dornan.
To ask the Scottish Government when it last met the SQA and what was discussed.
Cabinet Secretary Richard Lockhead, or Minister, sorry. No, Richard Lockhead. Yeah. There we are.
Thank you, and thank you for the promotion, Presiding Officer. Can I just answer the question by saying that the Deputy First Minister holds regular meetings with the Chair and Chief Executive of SQA, and he last met both on Tuesday the 16th of April, where a range of matters were discussed, and Scottish Government officials are also in regular contact with SQA officials.
James Dornan.
I thank the Still Minister for that response. Considering the Sultan of Brunei's deplorable views towards his gay subjects, including, unbelievably, the attempted introduction of death by stoning until international pressure forced him to U-turn, does the Cabinet Secretary agree with me that the SQA should reconsider its links with Brunei and reaffirm their role as an equalities champion for Stonewall?
Minister.
The new legal regime in Brunei, which oppresses so clearly the country's LGBTI community, is of course abhorrent, as I'm sure we all agree, and has no place in the modern world. Although independent of ministers, as a public body, SQA has a duty to contribute to the advancement of equality. And with that in mind, SQA carries out due diligence for all of its contracts and has regard to Scottish Government policy and Foreign Office advice and guidelines. SQA approves all its centres, including international centres, to the same standard, and every centre offering SQA qualifications must ensure that there are no discriminatory barriers and everyone eligible to take a qualification has an equal chance of benefiting. The standards include the requirement for the centre to have a number of policies and procedures in place, including a candidate equal opportunities policy and a candidate's complaints policy. So I hope that gives a reassurance of the Government's position and SQA's position on these matters to James Dornan.
And Liz Smith.
Thank you. Could the Minister just confirm that the organisation of this year's SQA Diet of Exams was highly successful and that no major issues have been reported to the Scottish Government?
Minister.
Well, as the member can imagine, we are in regular contact with the SQA on a whole range of issues, and they have assured us that the 2019 exam diet and all the activity in connection with that remains on track. And of course, given some of the other issues they're dealing with just now, we have agreed contingency plans with the SQA and partners to ensure there's no disruption to the qualifications and the awarding system.
Question number 2, Joanne Lamond.
Thank you. To ask the Scottish Government what its response is to reports that Glasgow City Council has received more than 14,000 requests to deal with rats since 2016.
Minister Kevin Stewart.
Thank you, Presiding Officer. I'm aware of recent media reports about the number of rats Glasgow City Council dealt with since 2016. Under Section 2 of the Prevention of Damage by Pests Act 1949, local authorities in Scotland are obliged to take such steps as necessary to ensure that as far as practicable, their district is kept free from rats and mice. Glasgow City Council does this through its own in-house pest control team, discharging their statutory responsibility through this and by ensuring that there is adequate waste collection services to households, which is a duty set out within the Waste Scotland Regulations 2012 and the Environmental Protection Act 1990.
Joanne Lamond.
Thank you. Does the Minister share my concern at the scale of this problem and the implications for the health and well-being of the citizens of Glasgow, that no matter what the responsibilities of the Council are, there is clearly a serious problem here? When will the Scottish Government accept that its choice to make substantial cuts to Glasgow's budget is having a direct impact on the frontline services that we all rely on? And when will the Minister Take responsibility and ensure that Glasgow gets the fair funding it so evidently needs to keep our streets clean and our citizens healthy.
Minister.
I do share concerns about the increase of pests wherever it happens. However, I don't share Ms Lamont's view about local government funding, because this government has been extremely fair over the years in terms of the settlement that there has been to Glasgow and to the 31 other local authorities. Glasgow City Council is currently investing £6.5 million into a 3-phase bin replacement programme, which will replace approximately 48,000 existing small dustbins with 80,000 larger capacity wheel bins to prevent overflowing, which can attract pests. That programme could have been done previously under the previous Labour regime, but it has taken an SNP-led council to sort out these problems.
Question number 3, Bill Bowman.
Thank you. To ask the Scottish Government when NHS Tayside's next annual report on drug deaths will be published.
Minister Joe Fitzpatrick.
I understand the Tayside Drugs Death Review Group plans to publish its annual drugs death report this month. This will include information on all drug-related deaths that occurred in Tayside in 2018. National Records Scotland is expected to publish its annual report on national drug death statistics in July.
Bill Bowman.
I thank the Minister for that response. ISD Scotland published data last week showing that over the past 20 years, there was a 4-fold increase in the rate of drug-related general acute hospital stays. This includes a critical increase of admissions by approximately 50% across Tayside, driven by the region's most deprived citizens over the last decade. Does the Minister agree this state of affairs is devastating for the people affected? And can he advise the Chamber what is being done to address deprivation levels which are reaching a breaking point across NHS health boards?
Minister.
I absolutely think the levels of people who are suffering harms and death from drug-related harm is an emergency in Scotland. That is why we have a new drug strategy which is intended to look at the services that we currently provide within the competences we currently have. But I think it's also important that we look at the options in terms of reducing harm, which are not currently devolved to this Parliament. And I would strongly urge the UK Government to accept the public health emergency which we are in and support the proposals for a safe consumption space in Glasgow.
Question number 4, Liam MacArthur.
Thank you. To ask the Scottish Government what assessment is made of the provision of mental health services in Orkney.
Minister Joe Fitzpatrick.
The Scottish Government wants everyone to be able to access mental health services and to get the help that they need when they need it. We are supporting health boards across Scotland to achieve this through £54 million funding over the next 4 years for capacity building and improvement support. An additional £250 million of investment in mental health through Programme for Government and funding for an extra 800 mental health workers. Funding for this will rise to £35 million per year by 2021-22. The Scottish Government expects NHS Orkney and their partners, including the Health and Social Care Partnership and NHS Grampian, which also provides specialist care, to ensure that there is appropriate provision of mental health services for residents on the island.
Liam MacArthur.
I thank the Minister. In her review of Orkney's mental health provision in 2017, Professor Linda Gass identified the need for increased capacity in CAMS services as, quote, urgent. With an increase in referrals, the pressure on the local CAMS team has only intensified since then. I'm also aware of specific concerns in relation to the availability of support for those affected by eating disorders. Will the Minister therefore undertake to work with the local board to ensure any existing gaps in CAMS and the wider mental health team are filled as soon as possible? And following my exchange with Claire Hawkey last November, will Ministers also review the issue of patient transfers to Cornhill, which now requires staff, including CAMS staff, to travel from Orkney, thus impacting on scheduled appointments and putting additional pressure on an already stretched service?
Minister.
long waiting times for CAMS treatment and support are unacceptable. So I thank the member for raising this particularly important point. We expect all health boards to deliver the standard that 90% of patients are seen within 18 weeks of referral. And the Scottish Government is currently working with NHS Orkney to agree their annual operational plans, including how they will deliver the standards. The member additionally mentioned the issue in relation to Cornhill and the transfers and the service level agreement. Of course, there is a matter between the health boards. I understand that NHS Grampian have confirmed to officials that they have adequate mental health nursing capacity for the provision of services, but the Scottish Government expects that health boards to meet those service level agreements and ensure appropriate provision of mental health services for residents. I understand that NHS Orkney and NHS Grampian are currently reviewing the service level agreement, which will be an opportunity to address the particular issues of patient transfers, and the Minister for Mental Health has, I understand, asked officials to look at that matter further. I know that the Minister is also aware of the particular issues around Cornhill, and I'm sure the Minister will be content to discuss that matter further with the member.
Thank you. Question number 5, Angus MacDonald.
To ask the Scottish Government when it last met Falkirk Council to discuss its plans for 1,000 new social and affordable homes by 2024.
Minister Kevin Stewart.
Thank you, Presiding Officer. Scottish Government officials last met Falkirk Council to discuss its affordable housing programme on the 15th of May 2019. I'm pleased to say we remain on track to meet our ambitious 50,000 target and are proud of our record on delivering affordable homes in communities right across Scotland, over 82,000 since 2007. Over this Parliament, £50 million is being made available to Falkirk through the Affordable Housing Supply Programme, investment that has already supported the delivery of 295 homes over the first 2 years of the programme. In relation to housing delivery beyond the current programme, we're committed to continue to promote increased supply across all tenures and build on our More Homes Scotland approach. And we're working with stakeholders to develop a shared vision for our homes and communities for 2040 and a longer-term approach to housing delivery, which will help make it a reality.
Angus MacDonald.
I join the Minister in welcoming Falkirk Council's ambitious plans. However, at a recent briefing at the Council, I was informed that according to the Affordable Housing Supply Programme benchmark, the Council receives between £57,000 and £59,000 per unit. However, RSLs for most areas of the Falkirk Council area receive up to £72,000 and for rural areas £74,000 per unit. Can the Minister advise why there is this unequal treatment of local authority housing services in relation to grants, tax and other forms of subsidy compared to RSLs? And will he commit to reviewing the situation with a view to a fairer outcome, not just for local authorities, but for tenants and council tenants in particular?
Minister.
Presiding Officer, our grant subsidy benchmarks are in line with the recommendations of a working group which both COSLA and the Association of Local Authority Chief Housing Officers were represented at. Benchmarks are not fixed grant amounts, which is important. It means that there is flexibility to approve additional subsidy if required to enable higher cost projects to proceed. If a project is found to be deliverable and provides value for money, we will support it. And beyond that, in terms of flexibility, I've said it before in this chamber, but if an authority is looking to build more specialist housing, including wheelchair accessible housings, and larger bedrooms, homes with more bedrooms, then we will look to be very flexible indeed with subsidy levels.
David Stewart.
Thank you, Presiding Officer. When the Minister next meets Falkirk Council to talk about affordable housing, can he raise the issue of sprinklers? He will know that government's adopted my bill to ensure sprinklers in all new housing by 2021. This will ensure the safety of tenants and avoid another Grenfell Tower.
Minister.
I'm very happy always to hear suggestions from Mr Stewart. He and I have worked cooperatively in ensuring his vision for sprinklers becomes a reality in our social housing in the near future. I am always happy to ensure that local authorities know about our future plans when it comes to building and fire safety, and he can be assured that that will continue to be in the agenda when I meet every local authority.
Question number 6, Peter Chapman.
Thanks, Presiding Officer. To ask the Scottish Government what plans it has to invest in the Scottish Ambulance Service.
Cabinet Secretary Jean Freeman.
The ambulance service will receive baseline funding of £259.9 million in this financial year, an increase of £9.2 million over the previous year, to support the ambulance service strategy, which sees patient treatment delivered out of hospital where it is safe to do so. Investment totalling £24.6 million since 2016-17 has been made. Peter Chapman.
I thank the Cabinet Secretary for that answer. Last year's figures showed response times in Aberdeenshire areas like Turriff and Mearn suffering some of the worst response times at an average of 18 and 15 minutes, well out with the 8-minute target. And a recent report by Unison said that Scottish ambulance staff were being overworked and patients being put at risk by Scottish Government underfunding. Does the Cabinet Secretary agree with me that this is unacceptable, and how does she propose to improve emergency response times in rural areas of the north east of Scotland?
Cabinet Secretary.
So I don't accept the central premise of this, that there is underfunding to our ambulance service. Mr Chapman, I'm sure, has familiarised himself with the strategy, which now has significant external evidence from across the UK that it remains a valid model and implementation is on track. In the next year, the ambulance service will concentrate on further development of their clinical response model, including improvements to lower acuity calls, development of their workforce, continued investment in fleet equipment and new technology, and quality improvement work, all of which is designed to improve their response times, particularly in lower acuity calls. And in terms of the recent Unison survey, of course we take these matters very seriously, as do the ambulance service, and with Unison they are involved in the Demand and Capacity Implementation Group, which is looking precisely at the issues that Mr Chapman addresses. So we'll continue to take these matters seriously and to make progress with our ambulance service.
Gillian Martin.
Thank you, Presiding Officer. Firefighters in 2 areas of my constituency, Turriff and Maud, participated in a trial scheme launched in 2015 that saw specially trained firefighters deployed to administer vital CPR or use a defibrillator to try and save people who were experiencing cardiac arrest. I've spoken with firefighters in Turriff who participated in the trial, and they are very keen to use their skills. Can the Cabinet Secretary advise if and when this will be rolled out?
Cabinet Secretary.
The primary aim of these out-of-hospital cardiac arrest co-response trials is to reduce response times to incidents with the longer-term aim of improving patient outcomes. The trials involved 18 stations, responded to 276 incidents. Scottish Fire and Rescue Service made 83 potential life-saving interventions with 28 positive results. Given these outcomes, the trials, I think, can be considered a success, and I am very keen to see this work rolled out. However, there are ongoing discussions and negotiations with the Fire Brigades Union and management in terms of the remodelling of the firefighters' role. That continues, and while those negotiations are underway and continue, the involvement of the Fire and Rescue Service in this work has been paused.
Question number 7, Maureen Watt.
To ask the Scottish Government what steps it is taking to deliver superfast broadband to rural communities.
Minister Paul Wheelhouse.
The £400 million Digital Scotland Superfast Broadband Programme has already delivered truly transformative results across all Scotland's local authorities, providing fibre broadband access to over 930,000 homes and businesses so far, with Think Broadband figures showing that over 93% of Scotland's premises can now access superfast broadband of 30 megabits per second and above. The equivalent figure for Aberdeenshire is 81.7%. Our £600 million Reaching 100% programme will deliver resilient and future-proof broadband infrastructure that will ensure every home and business in Scotland can access superfast broadband services, regardless of remoteness or rurality.
Maureen Watt.
I thank the Minister for that answer. Openreach are responsible for delivering broadband in the Old Port Lethen area of my constituency, Unfortunately, due to long lines, the community are experiencing frustrating speeds and either have to wait for the R100 programme to deliver faster broadband by 2021 or engage in the Community Fibre Partnership. Can I ask what support the Scottish Government can give to ensure a faster and more cost-effective solution can be found to tackle communities affected by long lines?
Minister.
Well, certainly, I should say at the outset, I very much recognise the challenge that Maureen Watt has set before us. Clearly, as Ms Watt is aware, these are reserved issues, but we are trying to use our resources to try and tackle them. We recognise that there's certainly a source of great frustration for those who are affected. We are obviously deploying R100, as I said, and I appreciate Ms Watt's point around the fact that people are concerned to be waiting for that. There is also gain share funding through the DSSB deployment, which has continued through 2018-19, will continue to during the rest of 2019, extending coverage as far as possible. And it is also for communities still struggling with poor connectivity, interim solutions such as the UK Government's Better Broadband and Rural Gigabit voucher schemes, which do exist. However, they may not deliver services at 30 megabits per second or better, but they may provide an interim solution while R100 is under development.
Thank you. And that concludes general questions. We're going